Welcome back to West Texas View.
Welcome back to the West Texas View. I'm Johnny Lou Avery, and Dr. Melinda Morris has been giving us some wonderful information. This has been such a great morning, and this time I want you to talk about what happens when I come into your office. How do you start helping me?
All right, well, let me promote the fact I'm at the Jenna Welsh Center in Midland, right next to Midland Memorial Hospital. But when you come in, I actually have designated days for urogynecology. So if your primary chief complaint or bladder symptoms, then we want to schedule you for a urogynecology evaluation. And when you initially present, we're going to want to do a full, thorough history and physical evaluation. And it's even more involved than just your routine annual exam, because we're really focusing in on the pelvic area, how it functions, neurological function, muscle function, chronic pain symptoms, leakage, the type of leakage you have, how frequent it's occurring, when it's occurring, and if there's any bowel issues as well, or any prolapse symptoms. So we're really focusing on that, and I have a 2-page questionnaire that you'll fill out. You'll have a urinalysis done to make sure you don't have any blood in your urine or infection in your urine, because we want to rule out those conditions. Kidney stones, bladder stones, they can present with similar symptoms. So we just want to do a thorough evaluation and rule out any etiology for the symptoms that you're having. We do a thorough evaluation, and there's actually an objective evaluation. It's called a POPQ scale, which stands for pelvic organ prolapse quantification. And it's actually a graph that I can fill out and document any relaxation or prolapse that you have of the bladder, the uterus, the vaginal mucosa, the rectum. So that can all be quantified to determine the degree of prolapse that you have. Then, depending on your symptoms, I may recommend that you undergo urodynamics. And what that consists of, another word for that is systometrics. And that's actually going to be an objective evaluation of how well your bladder functions. And so there's several different steps for that study. The first thing we have you do is you actually come in and you sit on a little potty chair and you void into the chair. And it actually measures how well you're emptying your bladder and the volume that you're voiding. After that, we're going to put you on the exam table, and we're going to measure what's called a post-void residual, where I'm going to measure the amount of urine that's left in your bladder after you've voided. Because some women don't completely empty their bladder. And if you're continuing to keep residual urine in the bladder, that's going to put you at risk for recurrent urinary tract infections and for leakage.
Because you're holding poison in your body.
You're holding it there, and the longer it stays there, the greater risk you have of developing infection. So we're going to check your post-void residual. Then we have little catheters with pressure sensors that are inserted into the bladder and into the vaginal area. And we actually start filling your bladder up with just salt water, normal saline. And what this is going to do is it's going to tell me the capacity of your bladder. Do you have normal capacity? Can your bladder hold the normal amount? Or for some reason is your bladder just holding a very small amount, and that's why you're having to urinate so frequently. And I'm going to have you tell me when you first get a sensation your bladder's getting full. I'm going to have you tell me when, okay, this is the point where I would normally go to the bathroom. And then I'm going to have you tell me, okay, this is it. I can't hold it
anymore.
If I was driving down the road, I'd pull over and go over in the ditch because I can't hold anymore. So, but all this information is telling me how well your bladder functions.
What would make you have a small bladder?
Well, there's a lot of conditions that can do that. Interstitial cystitis, chronic inflammation, women that have had surgeries, radiation therapy. So there are scar tissues. So there's instances where you may have just a very small bladder capacity, or your bladder's very stiff. It won't stretch. The bladder's like a balloon, that just fills up and then squeezes. But sometimes it's lost that ability to expand. There's a muscle that surrounds the bladder, the detrusor muscle. and it actually contracts to cause emptying of the bladder. So there's when you empty your bladder, it's a combination of that muscle contracting, and then you have a little sphincter, the bladder sphincter, that relaxes. So that muscle contracts, the sphincter relaxes, and that's how you can void. Sometimes you have a condition, it's called detrusor instability, where that muscle is just spontaneously contracting on its own. And that will cause urge incontinence, to where you have no control over it. That bladder is just spontaneously contracting on its own. And during that urodynamics, I can actually pick up those spontaneous contractions and determine if you have detrusor instability, because that's treated medically, that's not treated surgically. And then once
so what you're saying is these really serious problems have a pretty easy to fix solution in a lot of cases.
And sometimes they do, depending on your condition. And it's so important we do this study so we make the proper diagnosis, because there's so many different causes for leakage. And some causes are going to require medical management, some causes are going to require surgical management, some causes may just require physical therapy, Kegel exercises, some behavior modification, and unfortunately for some conditions there may not be a good treatment or solution. But it's very important to get the proper diagnosis first.
This is fascinating, because so many women just think they have to live with this.
Yes.
I'm at that age where things are just falling apart and they just live with it. And so there's so many new things, new medications, new procedures that can be fixed. And we haven't even got into hysterectomies and how that affects some of this. But our program is over for today. Okay. We're going to ask Dr. Morris to come back and visit with us again, because she's just got so much information to impart. And if you would like to make an appointment or email her a question, those numbers are rolling across your screen. Thank you so much for joining us today. We'll see you next Sunday with another program.
Thanks for joining us for News West 9's West Texas View with Johnny Lou Avery. This has been a public affairs presentation of KWAB-TV and KWES-TV.